Hi, everyone.
Nice to see you.
Hi.
Hi. Sorry about that. Technical difficulties. It's been a while. I heard my name. Are we starting?
Yes, if you wouldn't mind introducing yourself, and thank you again so much for for reaching out and wanting to speak on this topic. We're really grateful to you for your time.
I appreciate it. Yes, thank you. Chair Patterson, members of the committee. For the record, my name is Vanessa Hartman. I have the honor of representing House District 40, Gladstone, Oregon City, and parts of unincorporated Clackamas County. And thank you again for allowing me the time to provide testimony today. Because while I'm here in my capacity as a legislator, I am really here today in support of LC 100 as a mother and as a 37-year-old woman who is currently battling cervical cancer. As I have publicly shared, I was diagnosed in October with stage 3 cervical cancer, but my journey to becoming a member of this club that no one asked to be a part of started back in July. And I started having symptoms that were abnormal, but like most women, made excuses what they could be. Oh, it's just stress, changes in my diet. I'm running again. I thought maybe I'm going through perimenopause. And once September rolled around, they were getting worse. And so I thought to myself, okay, like it's time. I'm due for my annual PAP with the last one that I had about 5 years ago. And so I scheduled that check-in. And within about 5 days of that, as I was leaving work, I received the call with my results. And I remember feeling rushed, like I was running late. I had to take my daughter to soccer practice. I was running through what am I going to get me for dinner, just a normal day. And I answered the phone and, sort of always, as I always do, hello, this is Vanessa, with this silly smile on my face. Unbeknownst to me, within 15 seconds would hear a word that I never thought I would hear. And that word was cancer. And I'll never forget the feeling of sitting there. And it was like all of the color and joy in the world just immediately faded away. So I felt very numb and in disbelief. And I remember even saying, like, are you sure? Are you positive? And there were many moments like that over the past couple of weeks and months. I was inundated with tests and results and tests and plans and inundated with this information and this new feeling and realization that this is my life now. This is my family's life now. And being me, I had this overwhelming need to understand. And it started out trying to understand, like, what did I do wrong? How did I get here? How does any woman like me get to have cancer? It stems from that diagnosis, but it also stems from 2 comments that I received from 3 different doctors through this process. And that is, we rarely see this stage of cancer develop in someone who's never had an abnormal PAP, let alone progress this far in such a short amount of time. And did any of your previous OBGYNs or doctors ask you if you were vaccinated against HPV? And those 2 comments are the reason that I really decided to be very public about my experience, because I really thought to myself, I can't be the only one. And I am very glad that I did, because sharing this journey has connected me with so many women here in Oregon and across the country and across the world who are experiencing the negative side effects of women's healthcare in this country. And one sort of area that I want to share that's in relation to this concept in this bill is when I shared about getting my first colposcopy. And if you do not know what that is, because I did not know what that was, it is basically a biopsy of your cervix. And I heard from hundreds of women that shared their experiences about being told by their provider that they needed a colposcopy to further understand how far along their cancer was or their diagnosis was. And many women telling me that when they went to go schedule that colposcopy, that their insurance did not cover it because it was not coded as a preventative service. And there's one Oregon woman who I am still in contact with who reached out to me directly to tell me that her story or my story encouraged her to go get her checkup. It was overdue. She seemingly had no symptoms that gave alarm except maybe some lower back pain, painful periods, all symptoms that she chalked up to be just normal women's, life. And unfortunately, she got the call that she had tested positive for high-risk HPV and that there were existing signs of cancer and that she would need a colposcopy. She then told me that her insurance did not cover it and it was going to be $1,000 out of pocket. She's a single mother of 3. And to this day, she has still not received that procedure because she cannot afford it. And so for me, it breaks my heart. And I want all of us to think about imagining knowing you have cancer and you can do nothing about it because you cannot afford a medically necessary test to continue and learn about your treatment and further your journey. And again, this is a single mother. And unfortunately, this is not a unique story. I've heard dozens of these stories personally just in the past few weeks and the past few months. And as I have learned, cervical cancer is one of the most preventable cancers we have. And yet prevention only works when people can access every step of care, not just the first screening. And screening without affordable follow-up is not prevention. It is a false sense of security. And so I'm not here to give you all stats. I know that there's many people coming after me that are experts in this field to talk about all of the things that we have been doing and why we need this work. And I know we have all seen this bill before, but I think just from a personal experience, not only with myself and from the other hundreds of women that I've been talking to over the past couple of weeks, that this is a real problem, that we have many people who do not continue with their follow-up screening because of cost and because it is not covered. And this is really where cancer gains ground. I have learned, cervical cancer is a silent killer because it is slow. But in just 6 short years, I went from nothing to having a 7-centimeter size tumor. And that is all because I have the fortunate ability to be able to pay for my healthcare and be able to get these tests as soon as I received these notices. And that is not the case for many, many women across the state. So for me, again, coming back to support this concept, I think it's a modest policy change with a very, very powerful impact. And I hope that it really shows that when someone gets screened and when that screening shows something concerning, cost is not the reason that they stop, that we really say prevention includes follow-up. So thank you for the opportunity to let me share a little bit about that. And I urge your support of this.